Hi. I had a question asked of me recently. What are the IG limitations of using large language models if you're a clinician? So if you're using Microsoft Office and you've got Copilot. I'm going to talk about this in a couple of different sections. What are the limitations generally of large language models? I apply this in pretty much any business I can think of, is to utilise the everlasting wisdom of Arthur Weasley. Don't trust something if you cannot see where it keeps its brain. And what I mean by that is that for using large language models where we're putting in prompts, do you know where that information goes? If you don't use it for anything that you wouldn't want published on the internet. So that's rule number one. Second part is, well, if you do know where that's being kept, is that someone else's computer or is it yours? Or your organisation's? If it's someone else's computer, then you're going to need to apply a couple of rules. You don't put any patient data into that, you don't put any personal data into that, and you don't put any confidential information into that. Those are not mutually exclusive. So if you want to understand, I don't know, get an idea of, you've forgotten how much blood loss is average for a maternity episode, so what's the average blood loss in birth, I don't know, something like that, then yeah, sure, you can. Or if you're trying to remember a particular kind of medical journal article that you can't remember the name of but you can remember the content, then something like Perplexity AI might be quite good for that. The third category is you've got a local LLM, and what I mean by that is it's on your computer or a computer owned by your organisation. I use that same computer very generally. Basically, the data doesn't leave the organisation. At which point, your own IG team and multidisciplinary team, really, of governance people from different governance groups, clinical governance, etc., should be providing you with some really clear rules about how and when you should be using that information.